Alright, Tristan, we are recording this interview on Friday the 15th of May, and yesterday, Thursday, and today, Friday, you are having a major international conference on FASD in Ennis, and I am indeed speaking to you from your conference. I was reading your press release about the conference a couple of days ago, Tristan, and it sounds great to be having this conference. Leading us up to talking about the conference, though, I'm reading from your press release. People in Ireland should be aware, though, that the state funding for people with FASD in Ireland is at an extreme crisis. Is it not, Tristan?
Yes, that's correct. Despite the overtures from the Minister for Children, Disability and Equality, who have recently published that investment in disability services is to increase by 20%, the reality for organisations like ourselves is that when we ask about that 20% increase, we're told actually that's to fund the deficits from last year, so deficits from 2025, rather than to be an investment in this year. And as a result, budgets are being slashed, and that's not acceptable.
Yeah, from what I read on your press release, compared to a year or two ago, like your funding in FASD in particular, to talk about you in particular, has been cut hugely. So, just looking at the rest of the year and going to next year, Tristan, do you and FASD Ireland have enough funding to continue to provide your services?
Well, it would be wrong of me to even suggest that we do. We are facing a very dim future at this time. However, I've spoken to all of the people who I employ, and at this time, they do face that very uncertain prospect. However, we employ a very small team, and they're very committed to the work that we do, and at this stage have shown me an indication that they are happy to carry on as volunteers until we can identify alternative and probably, should I say, more secure and reliable funding streams than the government departments can offer us.
We could do a whole interview on this topic. Just talking about, and this is related to what we're just talking about there, like the prevalence of FASD in Ireland. I read today that 7.4% of the population have an FASD, which is very high if you think about it. As this 7.4%, Tristan, is an average, would it be true to say that this number is higher in some communities?
Yes, the statistic that you use that says 7.4, and we look at that as a very conservative number. It was published by the HSE in their 2022 position paper on fetal alcohol spectrum disorder, and they stated that prevalence in Ireland will be somewhere between 2.8 and 7.4%, but they have not done any prevalence research to even give any backing to that number. We actually think that that's incredibly low, and that the truer number is much higher. And why we say that is because there are figures available from the HSE, and indeed they have published them in parliamentary question responses, where they are estimating the numbers of people born since 2022 living with FASD in Ireland is 1 in 10 babies. So on an average year, that's around somewhere 5,400 to 6,000 babies. And how that equates, and what we're seeing today, is that in every class of 30 children, 1 or 2 will live with undiagnosed FASD. So this really is a silent epidemic that is racing down the motorway to us, and it's something that we have to be prepared to deal with. And it's not just affecting Ireland, it has affected some of Europe since COVID. We have seen numbers increase, but there are strategies available and there are prevention measures available. But this government does not want to engage with any organisation that can help it to be able to reduce or flatten the curve of the numbers of babies being born with fetal alcohol spectrum disorder. And perhaps if you'll allow me just to continue there, what I will say is, for your listeners, if you're wondering how it happens that a baby is born with a form of FASD? Well, it can happen in two different ways. One, as most of your listeners will be aware, a mother should not drink any amount of alcohol immediately before conception or in the 9 months of pregnancy. But here's the fact that most people don't know. A man should not drink any amount of alcohol in the 90 days before conception. If a man drinks any amount of alcohol in the 90 days before conception, it can lead to one of three things. And the first one is that it makes the egg more susceptible if the mother is consuming alcohol. And remember, 2 in 5 pregnancies go unplanned in Ireland. So it's fairly legitimate for people just to carry on drinking if that's part of their social fabric, unaware that they're pregnant. But secondly, what it also does is with paternal drinking, so where the dad is drinking before conception, it means that the child or the baby may be born with symptoms that are similar to, but not, autism or ADHD. So presenting symptoms similar to ADHD or autism. And then thirdly, and this is the most shocking piece of scientific research that's been available for at least the last year, which is where a dad is drinking alcohol, he is predisposing his offspring when they reach 40 years of age, they will or may encounter cardiovascular, renal, inflammatory or diabetic conditions. And that's really setting up our future generations for huge amounts of ill health. And actually, if you look around the hospitals today in Ireland, that would be very indicative of men drinking unaware up to 40 years ago or beyond, but in the 90 days before conception. And I think that answers a lot of questions about why our health service is under pressure. Remember, FASD is costing Ireland €4.6 billion every year, and this government is doing nothing about it whatsoever.
Yeah, I wasn't actually aware of that. You're not supposed to drink for 40 or 90 days before conception. I didn't know that. I know you're talking there as well about older people who have an FASD or something like it. And as regards education nowadays, just I won't keep you all day on this point, but if 7 point or say 10%, if 10% is the average, and you said that works out as 1 or 2 children in each classroom, it would be say that there would be some. Would it be true to say that there would be some schools where instead of 1 or 2, you could have 3 or 4?
Oh, absolutely. I was recently working up in a school in County Roscommon in Ballinlough. They have 33 students in their school. It's a small community school, and they have 3 students living with FASD. So we are at the 10% or just slightly over. And remember, that's a really rural village school. But thankfully, the principal there has recognised that she has 3 students who live with FASD, and it's a primary school, so it's actually the perfect age where we can start to make interventions and help those young people to be able to live a more independent life as they get older, and it will certainly help to sustain them better through post-primary school as they grow up.
Just one more question, Tristan, before you give me a summary of your conference. Speaking of averages again, this is something I'm curious about personally. I don't know 100% what the answer is, but is this figure of 10%, like, would it be higher, for example, amongst the prisoner community in Ireland?
We know from research that's been carried out in Canada recently that 1/3 of their prison population lives with FASD. So it would be probably quite appropriate to say that ours is a little bit higher, because the prevalence in Canada across the population is about half of what the prevalence is here in Ireland. So if you work on that basis, around 1,700 people in our prison population are living with a form of FASD, and we know that on average it costs €100,000 to house an average prisoner in one of our prisons. And so, you know, do the math there. 1,700 times 100,000 is a heck of a lot of money.
Yeah, okay. Tristan, we mightn't have time to talk about it in depth, and I know it's actually continuing at the moment. I'm talking to you live, not live, I'm recording this. You're talking at your conference. Can you tell me a bit about your international conference in Ennis yesterday?
I can, absolutely. So I've just left a session where Dr. David Junior Gilbert is talking about exactly what you asked me, which is the prevalence of people living with FASD in our prison system. And we know that, that's because people who live with FASD have a real challenge in the recall of their memories. Their brain is not quite developed until much later in life. They have what we call a lack of impulse control, and they're not able to remember very clearly what happened earlier in the day. So they tend to confabulate and fill in the gaps with social triggers and various pieces of memory that they are able to achieve. And that means if they're under pressure from, say, the Garda Síochána in an interview, they will literally not know why they're there or understand why they're there, and they may end up just saying, yes, I was there, I did it, it was me, because they think it's going to get them out of the interview, but actually they've just essentially pled guilty to the charge. So that's a really great speaker. Later on today we have Ger Brophy, who is the Chief Social Worker for TUSLA, and he's coming in to talk to us about what TUSLA are doing for the care experience community. And again, in Ireland, we have around 6,000 children in care, and we know that around 2,000 of those children will be living with a form of FASD, and that number will be higher in, for example, Oberstown, which is one of our youth offenders locations in Ireland. And so Ger is going to talk about what TUSLA plans to do to help that section of the care experience community. We had a great day yesterday. I don't want to go on too much about it, but we had Jan and Rossi Griffin, who are a birth mum and her son, who is now 23, and they were talking about their journey. So Jan is a birth mum who didn't know, well, actually was told that she couldn't get pregnant, and so was quite merrily living her life and having the odd pint of stout after work, found out she was pregnant, but went to the doctors and said, I'm not sleeping very well, what can I do? And the doctor said, well, you can take some sleeping tablets, but we wouldn't suggest it because you are pregnant. So how about carry on having perhaps or something? And she said, well, is it okay if I stay on the stout? The doctor said, yes, that's fine. And the next thing is she has a premature birth and a child who is living with FASD. So a fascinating story. There are lots and lots and lots of families out there in Ireland today who would have very similar situations where they've got a child who is not meeting typical or expected milestones, and they are wondering why. And the answer is either through the dad or the mum having drunk a glass of alcohol, a single glass of alcohol, around the time of conception or through pregnancy. And I suppose I should finish off by paying tribute to one of our speakers that flew in from the University of Washington in Seattle, and that's Dr. Julian Davies, and he has run what is known as the world's oldest clinic for FASD. He's a clinical paediatrician, and he's been diagnosing FASD for the past 23 years, and he opened our conference, and we were very, very proud to host him here in Ennis in County Clare.
Just one or two other questions, Tristan, before you go. So the solution to end FASD, so people don't drink alcohol before or during before pregnancy and during pregnancy, is education. Like that's the work that you and FASD do, is it? And that you want to continue to do in the future, is it?
Yes, absolutely, Darren. We have been lobbying government hard, very hard, to be able to access schools so that we can go in and talk to TY students. It's a great time to talk to them because they are becoming sexually active, they are discovering alcohol, and the two don't mix. So we have lobbied the Department for Education really hard, but they're just not interested in the topic of FASD, and that's something that we would desperately want to do. But secondly, we need to educate the wider public, and we are engaging with Minister Jennifer Murnane O'Connor, who is the Minister for Public Health, and she's very receptive actually to us being able to put her message out. But of course she's a junior minister, and she needs to get that over the line with her boss, who's the Minister for Health, and again, she's just not interested in FASD at this time, and I think that's because they are terrified of the numbers and the costs associated with it. But like I said to you there, Darren, when we're talking about a cost of 4.6 billion to the public purse right now, then a few 100,000 investment to reduce that number dramatically it's a no-brainer, and our ministers really need to get their heads around that. So we have to educate our public. We have to give them the opportunity to know the risks around drinking alcohol when planning to start a family or when planning to grow their family. If you tell the public the risks, which you are helping us to do today, Darren, so much appreciated. If you tell the public the risks, then they can make an informed choice. The problem we have today is that the public don't know the risks. They don't know what the results will be, and so they're not able to make that informed choice. And the public have a right to know that, you know, alcohol and pregnancy may harm their baby.